Blaine, this week I would like to ask a quick question about one of the different types of treatments. It's called VFR. And I think there's some of your customers or patients that might also be interested in learning about this.
Sure, yeah. VFR is an acronym for blood flow restriction training. Did you want me to explain it now? Or?
Yeah, so let's jump into it. Let's talk about what BFR is and like why would someone do blood flow restrictive training on their muscles?
Sure, that's a good question. So blood flow restriction is a type of training where you put a cuff, like a tourniquet, around either your thigh or your arms, and you actually exercise with the blood flow cuff around your arm, and that includes some of the blood flowing to and from your muscles. It doesn't completely include the blood flow, but it restricts it somewhat. And so, yeah, why is a big question that most people have. Why on earth would you do that?
Yeah, you would think, oh, I'm adding a tourniquet to this. Why would that be helpful to my muscle training?
Yeah, and so the reason is because the blood flow restriction causes a physiological response in your muscles. So because your muscle's not getting the normal blood flow that it gets, then it feels like it's a lot more challenging than what the normal exercise would be. And it causes a physiological response, and it basically causes the muscle to strengthen more quickly.
All right.
And so the nice thing about it is you can strain the muscle without putting much of a load on it. So say if we put a cuff around your arm and gave you a 5-pound dumbbell to do bicep curls, so obviously a 5-pound curl for you would be very easy, but with the cuff it gets very heavy, it feels very heavy very quickly. So we use that a lot in people who have maybe they're not allowed to put a big strain through their joints if they've just had surgery, like an ACL reconstruction in their knee or an Achilles repair in their calf or something.
Yeah. Before we get into this, I think there is something we might want to do, a quick little warning to some patients that may want to do self-treatment out there. You might want to think about the amount of time that you should leave something like this on. So any thoughts on that?
Yeah, safety is always a concern. So we typically don't ever leave a blood flow cuff on for more than 15 minutes. And you want to know how much pressure you're putting on too.
Yeah.
And so it's good to have some guidance from an expert when you do it.
Yeah, I mentioned tourniquet before. Don't be tightening it down like a tourniquet, because that would definitely be a problem. So.
Yeah, it's not as tight as a true tourniquet, where a tourniquet would completely occlude your blood flow.
Yeah, and that might be a different physiological response, I would imagine.
Yes.
So, all right. Well, if there's anything else that you want to talk about, now would be the time. Otherwise, let's get into some exercises and show people kind of what they can expect.
The only other safety concern I would mention is you don't want to do it if you have a history of blood clots, so we don't put it on people if they've had a blood clot before, or also you wouldn't put it on someone like a pregnant woman or something like that. It's not appropriate.
Okay. And, well, actually, that actually brings up a question for me. What about if you have medication that can cause blood clots? Would that be something that would also be a risk factor that you might consider?
I probably wouldn't put it on someone if they're prone to blood clots, if they have a history of them, or also any type of venous disease. If you have spider veins in your legs, I probably wouldn't put it on someone like that.
Okay. All right. Well, let's get into some exercises, kind of help people understand what's going on, and just realize this is something that you probably should get the advice of an expert before you go in and just do it on your own. So.
All right, so this is the blood flow restriction strap, the BFR strap, and some of them are, I'm just going to put it around your arm here. So like I mentioned earlier, you can put these around people's arms, or we have bigger ones that can go around your legs. You can also do them around both arms at the same time. For the sake of this video, we'll just put it around one arm. But this model, we pump it up with it looks real similar to like a blood pressure cuff. So it has a dial on it, so I know how much pressure I'm putting on it. So I'm going to gradually pump this up. And if it starts to hurt, it shouldn't hurt. It'll feel fairly intense, but it shouldn't be painful.
Yeah.
So that's not hurting, is it?
No, but I can start feeling that it's restricting the blood flow in my hand.
Okay. So I got about 120 millimeters of mercury there. And some devices put on and they're battery powered and they can puff up right on your arm by themselves, and some are manual like this. But so we're squeezing in the upper arm here, and you always want to put up at the very top of the limb. If it's on your thigh, you want it to be at the very top of your thigh. But I would use this for, do you want me to talk about like reasons I would use this for?
Yeah, let's talk about it.
So I really like blood flow restriction therapy for any type of tendonitis issue. So like for example, tennis elbow or golfer's elbow, or if you have tendonitis in your wrist. And so that's a great way to really strain the muscles without putting too much strain on them.
Yeah.
So why don't we get into this, we'll go through a few exercises. So this is just a 5-pound dumbbell. So Greg has good muscle strength, so normally a 5-pound dumbbell would be easy peasy. But with the blood flow cuff, you'll start to feel it burn pretty quickly.
Yeah, I think I'm on rep number 4 or 5, and I'm already starting to feel not quite the burn. Like I could keep doing it, and it's also causing quite a bit of blood flow or veins. I'm thinking about it as a child when I spent time. You would do this on purpose.
Make your veins poke out?
Yep.
Yeah. And so you're starting to feel the burn yet?
I don't know how much more I can do actually, now that I'm starting to feel it.
So an exercise that would normally be very easy for you is starting to pretty good strain on you.
Yeah.
We also use this a lot for post-surgical things, and so a lot of times after surgery, we are not allowed to, we're really not allowed to do certain things because we could mess up the surgery if we did. So we can often put a cuff around your limb and do exercises that are challenging, but they don't put an excessive load on your surgical repair. So it's a great way to avoid muscle atrophy. And so I'm going to have you just pronate and supinate your wrist there.
Okay.
So this is a common exercise I might use for someone who has a tennis elbow or a golfer's elbow, depending on what we're working on. And this works certain muscles in the wrist and the forearm and the elbow.
Well, I know which muscles it's starting to work. Right here.
Yep.
Pretty quick. And I don't think I would have felt that as quickly. I don't know. Maybe I would have.
You really absolutely would have felt the burn way faster with the blood flow cuff on.
Yeah.
And then I'm going to swap that out. I'm going to keep your wrist up and you're just going to curl up like so.
Okay.
So this is another exercise I would commonly use for someone with a tennis elbow. And you should start to feel this burn right through your top of your forearm really quickly.
Yep, I feel it right here.
And one other safety concern, if it does start to hurt, it's okay if it feels fairly intense and really fatiguing, that's okay. If it starts to hurt, you've got too much pressure, it's okay to back the pressure off. Or it shouldn't cause your arm or your leg to go numb or tingle. So if you're going numb, then you've got too much pressure and that should be avoided.
Not yet.
Okay, good. Alrighty, and then we will hand you a 2-pounder next, and let's just have you go do some shoulder abduction like so.
Okay.
Another interesting thing about blood flow restriction therapy is they've done a lot of studies on it, and not only does it help to accelerate muscle strengthening, but it actually, interestingly, increases your VO2 max. And so your VO2 max is it's a measure of how efficient your body's functioning or kind of how good shape you're in. And so it's kind of an interesting feature of blood flow restriction training.
So I was introduced to VO2 max through running. I got to ask the question, do some runners do this just so that they can improve their VO2 max? Because I know some people are all about making sure that they max out every statistic that they can.
Yes, and the answer to that is yes, they do. It's actually a great tool for runners. I do it on myself. So when I was training for a marathon a few months ago, I put that blood flow cuffs on my thighs and I would jog a mile on them, and that was just so challenging. Your legs just feel like rock. They feel like lead the whole way.
But it probably would help you to be prepared for that mile 26 of the marathon.
It does. It's mentally very challenging, and there's some physiological benefits to it. It's also just a good, running can be a very time-consuming training protocol. And so sometimes instead of running a lengthy long run, I would just put on the blood flow cuffs and run a short run. And not to say that it's equal to a long run, but you're getting certain benefits from it that you don't get from doing a long run. And there's benefits to doing it that you don't get from doing just a regular short run either.
Nice.
So how's that cuff feeling?
It's pretty tight now. I'm guessing after a while you get enough blood in there that it starts building up behind.
It does.
And that's kind of what has started to happen. I can feel it engorging a little bit.
Yeah, it's not hurting, is it?
Yeah, slightly, but not like crazy.
Okay.
It's pretty, like it's starting to go numb, actually.
A little bit numb, so that's a sign it's probably time to turn it off. So I'm just letting the pressure off. That's always a good feeling to let the pressure out. You can feel the blood going into your arm again. So a couple other exercises that we could have done that are normally pretty easy. This is just a rubber donut you can squeeze, so like get grip strengthening. And then the opposite is this is a finger web where you can put your fingers in there and strengthen your finger extensors. So it kind of strengthens the opposite muscles as your grip strength. So these could all be.
So family members that play piano and things, musical instruments, this might be a good one for them.
It's very good for pianists, yes. But this is also a common exercise I would use for tennis level.
Mm-hmm.
So all of these can be done with a blood flow restriction cuff on. All right, so we're going to put these on your thighs.
Okay.
So you want to put them nice and high.
And in this case, because you add the pressure afterwards, I just need to get it on, right? And make sure that it's in the right position.
Yep, you just put it on first and then we'll add the pressure to it. So I'm going to go a little bit higher pressure on your leg than I did on your arm.
Okay.
And is your arm, is it woken back up?
Yep, the arm has woken back up and I won't have to lose my right hand.
Good. Okay, so is that,
It's pretty tight.
that's not hurting you, is it?
No, I don't think so.
Okay.
Ooh, maybe just a little bit less,
A
actually.
little much on that one?
Yeah.
What's that feeling like?
There's like a pinch
Okay.
on the quad and a little bit on the hamstring back there.
Okay, how about now?
I think down just a little bit more.
Okay.
Right there. Yeah.
That feels all right?
Yeah, I'm gonna feel this, I can tell already.
Yeah. It's not hurting you, is it?
No,
Okay.
not yet.
I'm just gonna make those fairly equal in pressure. So if you go ahead and move around just a little bit for me. Does it feel like I need to go up a little bit more on this side to match that
A
one?
little bit more.
So my pressure is equal to the other one, about
Right there,
now.
right there.
Okay.
Yep, I'm feeling that.
All right, so we got Greg's thighs strapped up in the BFR straps, and so we can really do any exercise that we want to in here.
So we could do a squat, for
Yeah.
example.
Yep. So suppose you are a weightlifter and you're trying to build up your squat strength, but your knees are hurting. So this would be a great substitute to.
Oh, yeah. Okay, good. I almost thought we didn't know where we're going.
So instead of squatting with a 200-pound bar on your back, you could just squat with your body weight and the straps on your thighs. And that's a great way to give your muscles a really challenging workout, but it doesn't put all the pressure through your knees.
Yeah, starting to feel that.
Yeah.
Starting to feel that.
And then we could also do some.
We'll do another one. This is one that we haven't really showed very much, but it's called a Bulgarian split lunge. And this is a modified lunge that, I don't know, I like it. I think it's a great exercise, personally. You get a lot of power out of it. So.
Yeah, a great way to strengthen up your quads on the front of your thighs there. So this is also an exercise we may do on for someone who's having some knee issues, and it's a pretty advanced exercise, so we might use this one for athletes quite a bit to build up their quad strength.
Mm-hmm. Your runners that are working on their sprint.
Yeah.
Because I imagine this increases your explosive power on a run, right?
Yes, Yep. There are a lot of benefits to doing blood flow restriction training. And so it can be used for training purposes and rehab purposes quite a bit as well. And I mentioned earlier, we do this on post-surgical rehab a lot, so whenever we see someone with like an Achilles tendon rupture that they've had repaired, we're not allowed to like have them stand on their tippy toes after that procedure, because that would be dangerous on surgical repair if we did that too soon. But what we can do, so we don't lose up all your calf strength, is we can put these cuffs on your legs and just have you do some real simple, like, you know, like
Oh, like just your leg. Let's see. Stop.
and so if someone just had surgery on their Achilles tendon, then we could put the cuff on their legs and just do some simple ankle pumps. Or we could also put like a rubber band around your toes and give you a little bit of resistance that way. And we could give your calves a good workout because of the blood flow cuffs without putting a strain through your Achilles tendons. So avoiding muscle atrophy is a great feature of these blood flow cuffs.
I like this idea.
Mm-hmm. And if you are far enough out that you are allowed to stand on your tippy toes, this is a great exercise to do with the blood flow cuffs as well.
Again, Blaine's favorite exercise,
Yeah.
doing the calf raise.
And we use this a lot for ACL ruptures as well. So if you have your ACL repaired in your knee, pretty much almost every visit you come, we're gonna put these cuffs on your leg as long as there's no contraindications. And we'll have you do a lot of exercises with the blood flow cuffs, so that helps strengthen your knees without doing anything dangerous with your newly reconstructed ACL.
Yeah. Oh man,
How's it feeling?
it feels like the same thing. Getting a little bit of blood engorging in there, and yeah,
It's pretty intense, isn't it?
it is pretty intense.
Yeah, and even just marching in place is a great, or just walking with the blood flow cuffs. And again, you don't want to go more than about 15 minutes, but most people don't really want to go that long because it's just really challenging.
Well, and I'm sure that it gets to a point where you're just like, oh, okay, I'm done with the pain, and
Yeah, it's a pretty intense feeling.
I don't know if I'm ready to do a mile in this. So running a mile. Mm-mm.
Yeah. When I would,
Hats off to you on that one, Blaine.
and in full honesty, I couldn't actually run the full mile. I would run probably about 2/3 of the time and have to stop and walk because it was just so exhausting.
Yeah.
Yeah. But the nice thing is when you take the cuffs off, you're not that wiped out like you would be after a long run.
Yeah.
So
Oh. Fun.
yeah.
Do it on your walk to work in the morning.
Yeah. You could also do some heel raises, so this would be a good exercise for someone with shin splints. So you should feel that burning in the front,
Yeah.
that muscle in the
I
front.
think because it's towards the end of, I mean, we've been doing this for what, 5-10 minutes now.
Yeah,
I'm starting to really feel the
feel the burn.
burn pretty quick.
Yeah.
Yeah. All right, I think I'm ready to be done with this.
Okay. All right. Do you want me to pause it or?
Oh, we can just release it right now.
Okay. So there's an air release. You just push that valve in. You just go straight in like this. Always a good feeling to let the air pressure out.
Oh yeah.
And then once you let the air pressure out, you can undo the Velcros.
I think I got it all. Oh, there we go. That's right. All right, that was a good experience. Not necessarily something you wish on everybody when you get into exercising, but it is definitely something that could improve your return. My own personal experience with blood flow restrictive training was I actually had some muscle mass that was down on one side of my leg once, and the doctor did some measurements. She identified that I had probably about 5 centimeters less muscle mass on my right leg versus my left leg. And we used this over the course of about, I don't know, it was about 6 or 7 weeks. And I did my normal exercises, and then we did that intensive training during those course of exercises with the physical therapist. And by the end of the time, the measurements were the exact same. And so it was pretty surprising how quickly that happened and how quickly I was able to build the muscle that I needed. So
Yeah, it's a great feature for that. So if you have any type of issue strength issue or you need physical therapy, really for anything from here down or in your leg from from your thigh down, it can be a good tool for that. Also, if you're just training, it's a great way to mix up your training and give yourself a really good workout without putting a lot of strain on your joints.
Yeah. Yeah, what a great product, and thanks for demonstrating it for us today, Blaine.
Yep, happy to do it.